Before we jump on, let's introduce our next super speaker, Dr. Abrar. Some of you guys may have heard Dr. Abrar's talk from last year. Pediatric training from the Northwest Indian, graduated from Pakistan, initially moved not to the UK actually initially. I'm so happy to call him back and introduce him back to you guys as well. I know last year's talk went down really well in terms of feedback. So yeah, without further ado, let's hand over Dr. Abrar and let's hear a bit about pediatrics and how you guys can enter pediatrics. Yes, brilliant, good to see you again.
Hello, good morning, guys. So this is my introduction, as Dr. Aurora already told you. Next, why people want to join pediatrics, or why I did join pediatrics is pediatrics is a vast specialty which give you a chance to multiple subspecialties. Like you can be a generalist in medicine or in surgery. There used to be a general surgeon and there used to be a general physician, which is not there anymore. It is only emergency and acute medicine and then subspecialties, but there is no general physician there anymore. So like we used to be a general internal medicine in the past, but that's not anymore. In pediatrics, there is still a chance that you can be a generalist and general pediatric consultant, and most of the people who come to the pediatrics, they do general pediatrics. Then you have specialization chances. You can do like multiple subspecialties as well if you want to. And then it is a very rewarding field in a sense, like most of the children, they have like short-term illnesses and they do get better. Their immune system is better and they fight back and bounce back quickly. And the research wise, there is a lot of research going on in pediatrics. If you want to opt a career in research or want to do part research, part clinical, pediatrics is one of those specialties you can do like a lot of research. And it is a diverse field, as you know, like the physiology and anatomy for a 24 weeks preterm baby to a 16 years old teenager, everything changes. Like every year things are changing and there's a lot of diversity. You can see, you can choose to become only seeing teenagers and you can choose to become only seeing small babies. It's up to yourself, or you can choose a specialty. So it's a lot of diversity in pediatrics. Constraint wise, it is people say it is hectic, but in the UK work time, like European work time directive, you only work certain hours. Even if it is hectic, you only work like 48 hours in a week, or 10 PAs. They say you only work as a consultant only 10 PAs. You can opt to work more than that if you want to, but it is like the contracts here in the UK is the good thing. Is it's not like that the rest of the world, like you are working 24/7 and long shifts. There is no long shifts here. Only maximum shift is 12 hours, 13 hours maximum. But the PA system, like the people who don't know what is PA system, one PA is like 4 hours of work, and you work like 10 PAs in a week. Like that is the average consultant.
Abrar, I think we're losing your voice. It's quite quiet. We just lost your voice in the last 10-15 seconds.
Oh, sorry. I think I was speaking a bit. Is it better now?
Yeah, that's a bit better. Thank you so much.
Yeah, I'll speak a bit louder. So the constraint I was saying, like the people say pediatrics is a quite busy specialty, but being a busy, like some subspecialties of the pediatrics are busy, like if you are in ICU, or if you are in like neonatal ICU, or some hospitals are more busier than others. But overall, you work like 10 PAs. One PA is around 4 hours, and 10 PAs is around 40 hours a week, and that is a standard consultant contract in pediatrics as in any other specialty. So it is not that hectic as people say it is. So this is one of my paragraph which I have written in my CV and written in my like applications as well, that why I want to join pediatrics, or why pediatrics inspire me and I want to do it. It is about like my own personal story. When I was doing internship, I saw a 2 years old child who was admitted in ICU with poisoning, and then after 2 days, she was running around the ward. So this way, you feel like in pediatrics, you have many patients, they just bounce back quickly and they get better, and it feels us happy that we are doing something which is making our patients better. So I'll give you a snapshot like how consultant pediatrician work. There are 4 types of consultants. This is like a very generalized idea, but there is a lot more detail into it. So I'll give you a like generalized idea. As a pediatrician, you can join as a district general hospital in the UK, and your on calls will be generally 1 in 6. What happens is you do your clinics or you do your ward round for for the week. So what they do is 1 in 6 means every 6 weeks you are a hot week consultant, and hot week consultant means you do the ward round every day from 9 a.m. to like say 12 uh, or 11 lunchtime, and then afterwards you're just looking after the ward patients until 5 o'clock, and then you hand over to somebody else. Okay, and that week is every 6th week, and the rest of the 5 weeks what you're doing is you're doing your admin work, you're doing your clinics, and then you're doing your on calls. And on call means 1 in 6 times means your on call comes once every 6 days, like once a week. So the on call, the day you are on call, you don't come to the work before 5 o'clock. You come to the work at like 4, half 4. You take handover from the ward patients, and then you stay there like until 9, 10 o'clock, and then you are on call from home until morning. And next day you don't come to the work. So this is how, like, when you are on call for the night, you previous day for the routine hours you don't come to the work, you come into the evening shift, and then night time you stay at home only for emergencies, like very sick emergencies. When the patients are dying, you go back to and support your registrar, and next day you don't come to the work. Sometimes you have clinic next time, but that is very rare. Okay, and then next specialty, like next type of, you can do a community pediatric consultant. And community pediatric consultant is you are in the community and only seeing as outpatients, and that is like office hours job, 9 to 5, and that people say is very boring job. Boring means like there is not a lot to do and relaxed job. And you can become a community pediatrics if you want a relaxed job and not much going on, no hectic schedule. And then there's two types of like specialty consultants. One is special interest, and other is like tertiary level grid consultant. So these are like when you're in the training, I'll explain in the next slides. When you're in training, you either become a specialty interest consultant, or you become a like full-blown specialty consultant, which works at like tertiary level hospitals. For example, if you want to become say rheumatology, pediatric rheumatology consultant, so you do like at ST4, ST5, you apply for the grid training and become a rheumatologist. Or if you do 2 years special interest in say diabetes or even in rheumatology, you still work in a district general hospital and you see clinic patients in your clinics at a district general hospital. The specialty is like you want to do general peds as well as some specialty as well, but the patients who needs the tertiary level care, you just refer them to the tertiary level. So this is the shape of the training at the moment. Pediatric training is a run-through training for 7 years. After your internship or your FY1 years, after you like fill in your CREST form and then apply for the training, you join in as ST1. So as ST1 to ST3 is called the level 1 training, and ST4 is generally now the training as like level 2. And after this you can apply for spin when you're ST5, or you can apply for the grid. So 70% people either they go for the general pediatrics, or they go for the spin optional, and then 30% goes for the subspecialty or called the grid training. For some specialties they require, if you want to become the consultant of that specialty, you have to apply for the grid training. So previously you can see at the bottom of it there is say MRCPC theory or MRCPCH clinical. So it used to be by end of ST3 you have to pass the MRCPCH clinical exam, but with the COVID time they just gave some relaxation for now, that by end of ST4 you can pass the clinical. But it always used to be that you have to pass the clinical by end of ST3. So this is an overview of the training, but if you have more questions about this training pathway and the training, you can email me later on, and I will definitely you can answer those questions. Next is application process. In pediatrics there is no MSRA, there it was only 1 year, but college hasn't announced any further MSRA like that. So there's no MSRA in pediatrics application. Next is the application itself, that is the shortlisting tool, but it is announced in the November. So this year applications will open in November, and the interviews will be happening in February or March. So I'll go through a bit detail about the application process. So these are the applications for the people who joined now, like who are joining in September this year. So these were the dates for those people who like interviewed in 2022 and they're joining training in September 2022 this year. So college hasn't announced any dates so far for the upcoming year, so I'm using these dates. I've given the links for the site you can see, or you can just go to the Royal College of Pediatrics and Child Health and just write ST1 training or the pediatric training, and the loads of the links come up, and you can find these details there as well. And for the competition ratio, this is the ratio from 2020, and this is on the college website, and it hasn't given the updated information so far. The applications in 2020 was 712, and 645 were called for interview, and there were 461 posts for, and that is like 1 into 40, like 1.4 ratio. So this means like there were like one and less, just under than 1.5 candidates for each post, 1.5 candidate for each post. So there's very good chances if you want to do pediatrics, you will get pediatrics training. If you not like, if you just work a little bit harder for the application. So the application is on Oriel as any other like specialties. Most of them are there on Oriel, and they are free text questions. You just have to answer the questions, and some of the questions are like just they have like certain marks. This is on available on the college website. You just have to see like what is written in them. If you have done CTCH exams, you have done any further qualification, this one is a straightforward. And then there are like 7 questions. If you have any transferable clinical skills, you have done audit, you have clinical experience, have you any experience of leadership and management, any academic achievements, teaching and education, and why you should do pediatrics. So these are the questions. I'll just go in a little bit detail in the next slides. So these are just the key points out of every question, just summarized here. So for the transferable skills, you can tell these skills, like you have done ALS or you have done cannulation, which you can teach to other people. And then for soft skills, you can tell like you're a good team worker, you have good communication, you have empathy, and you have ability to make complex decisions. And then for your clinical experience, you can tell that in your foundation job, you did pediatrics, and in your during your medical school, you did pediatrics, and or you did a taster week, or you have done some rotations in your GP or in your A&E jobs, or you in your A&E jobs, you can even see that you were rostered as like some days you went to pediatric A&E and you see children there, and then medical school module. So you can use that experience in your application. And then audit and QI, as is told in the previous presenters talk as well, that you have to do a full cycle, and that is very good to boost your application. And then if you can prove that you have regular involvement in the audit and quality improvement projects, there are 4 marks for that. And then for the leadership, you can see like leadership roles in your university projects, in your clubs and sports. It doesn't necessarily have to be, because you are starting your career in medicine, and this leadership roles, you didn't get much time to go into the like to do that was leadership in the medicine. So you can do from your medical school, like you were a sports person and you were captain, or you did some type of leadership in any clubs, or in the medical emergencies, you can say like before the person who was a team leader, you have led this. Or even if you have done the ALS, during the ALS you lead some of the scenarios, and you can use that one scenario to give in an example that you did this, like you led a resuscitation, and you were the leader there, and you told everybody what to do. And then MDT and handovers and organization skills, you can tell as a leadership, like you were organizing teachings and all those things. In your academics, you can tell that you have been presenting your presenting at the general clubs. I don't expect that you guys would have any publications, but during your FY years or internship, you can use, like, ask some of the consultants if they're doing something, and you can work along with them. You can help in academic writing, and you can help in like data collection or whatever. And then if they are publishing those, even if your name is at the end, like, you can use that, like you have been involved in that. And in the teaching, informal teaching, you can become an OSCE examiner. They're always asking for the OSCE examiners because they are short all of the time. So you just have to volunteer yourself and go there as an OSCE examiner. And informal and departmental teaching, you can do like a grand round teaching, and you can do as like small group teaching in your department wherever you are working. And the suitability for the pediatrics, this is just how you tell, like, why do you want to join pediatrics. This is your own experience, and ask yourself, and then write that, and what are your interests, and why do you want to do pediatrics out of any other type of medicine, and what strengths you can give to pediatrics, and why do you think you will be a good pediatrician. So you can Google for these questions, and you can find the answers other people have given, and then you can tailor your answer, like, and you can, like, that will help you to write up how do you want to write your own answer. So in the application, whenever the date opens, so you know the, like, questions will be the similar to the last year. What you can do is you can just write in a, say, in a notepad your answers, and then when the application opens up, you can just copy paste those questions, those are your answers, and start early writing, because the writing takes time. If you want to write original and good writing, it takes time and needs multiple revisions. And the marking scheme, the given in each question, you just see, like, if you want to score high, aim for the higher score in each station, and after you have written, ask somebody senior to read your answers, and then avoid the just filling phrases. I feel that I could be argued. Just be straightforward and link up your things, one point to the next one. And then don't undervalue any work you have done so far, any non-clinical, any non-medical experience. Don't value. If you were a leader, you were a leader, doesn't matter whichever field it was. Okay, and if you have good organization skills or good teaching skills, you are a good teacher. So don't undervalue yourself. Even non-pediatric skills you can link, and because they know that you started your career, and you won't have that much experience as others would have, like, as compared to like people who are applying for senior posts. Okay. And
Hi, Abrar. Sorry, I think that the voice has gone quite low again. Just had a couple of messages from people saying they can't hear.
No, sorry, yeah. So link your, like I'm saying, like, link your non-pediatric and non-medical experience back to the pediatrics. Like, if you have done your leadership in a non-pediatric, like in a sports or in your university project, how you can use that experience into pediatrics, and then non-pediatric experience as well, you can link back into pediatrics, and then use specific examples and show reflection, and you can use your MSF in that. Like, see how people think about you. Like, you cannot see yourself as you are, but other people sees you in from a different perception, and when they write in your feedback, like how this person was and how this person is, and then you can use that, like, that experience or that feedback into your own answers to those questions. So this is one example. This is from my fellow trainee who wrote this example in the, so working in a GP environment. She wrote, like, she was working in the COVID-19 patients and who were extremely unwell, and sometimes palliative patients, and there were visiting restrictions, and the families were very anxious about what is happening with those patients. And she is saying that she uses empathy, and she was listening. So she's saying, like, she was empathic and she has good communication skills, and then listens to the ideas and concerns of the parents, sorry, of the families, and then ensuring that communication is open, constructive, and ideally restorative. You'll get these slides. So and building on these skills, she will use this in pediatrics, and in particular recognizing that the patient is a mother of a wider family group. So what is she trying to imply is that uh, in COVID-19, what she experienced is the families were away from the COVID-19 patients, and she was the link in between. Same way in pediatrics, what happens, the children cannot communicate for themselves, and she will be communicating with the parents instead of the children. So this is, she is like making an analogy, and just in this paragraph and she's also telling that these are the qualities in her own like personality which she used in this. And then she's given an example in last 4 lines, like, so during my GP rotation, a parent expressed concerns about the 10-year-old daughter behavior, weight and nutrition, and I sought help from the MDT within the practice to explore the medical, psychological, and emotional factors involved. Okay, so this is quite like a thick paragraph and condensed paragraph, and you can use this as an example. Just don't copy paste this one. You can use this one as an, let's say, an example, and you can write your own. So interview, last year it was different because of the COVID-19, and we don't know how it will happen the coming year. So generally the interview is like there is a communication station in which there is a, say, similar to lab exam and similar to any other exam, there will be an actor. There will be no real patient, there will be an actor, and they'll give you communication station. Say for example, any like communication scenario, patient doesn't want to take the medicines, and ask like address their concerns, or they're taking medicine, they're not getting better, and they have few more questions to ask, and you just talk to them. Any type of, they don't want to know what you know about the pediatrics. What they want to know is how you communicate. They just want to see your communication skills. Even if you don't have knowledge of pediatrics, does not matter. You just say, you will ask your seniors, but the way you communicate with the patient, that matters. And career motivation, this is like, why do you want to join pediatrics? A similar question which you have written in the application written, and then the reflection practice questions as well, and the clinical reasoning. So reflection practice questions would be like, they'll ask you like, in your reflection of your like your practice so far, what gives you an example. Like the interview preparation is a separate whole thing. I'm just trying to summarize it a bit like for you. So uh, like reflection questions would be like, they'll ask you from your own experience if you can reflect back on any like case where the outcome was very good or outcome was bad, or which you can say like it change your practice. And then clinical reasoning is like a table viva. They'll ask you, a patient comes in this, and what you want to do next. For interview tips, you can have this book, and there are private coaching as well. People get private coaching, and people do read this book. And then I say the easier way is, uh, take a camera, record yourself answering the questions, read this book, and then keep practicing with your mates. That is the best way to do it. Next one is, say for ST3 and ST4, the ad comes a similar time around November, and then interviews around March, and joining in September. So this is the eligibility criteria. You can join pediatrics and ST3 and ST4 level as well. But the people who are already doing pediatrics and want to join ST3 and ST4, I won't go that much into detail, but they know already what they do. I'm just focusing on the ST1 applications. So applications come in November, interviews in January or February, and the exams, if you have done, that's good. If you haven't done, this not a part of the thing. And pediatric experience, you don't need any. You need ALS for this, APLS and NLS. If you have done it, that will be good. If you haven't done it, don't worry, you will do it when you join the training. And safeguarding level 1, you can do online safeguarding courses that like 5-10 pounds, 20 pounds maximum. You can do the online safeguarding courses for level 1. And then the crest form you need for applying for ST1. The interview format questions, as I told you already earlier, is the same for ST3, ST4 as well. But the interview pattern might change this year. It might be face-to-face interview, and the college will give you guideline like how the interview will be. So this was everything about my talk today. If you have any questions, you can ask now. You can email me later on. And recently I've just started a YouTube channel as well, where like most of the videos are in Urdu and Hindi. So where I talk about pediatrics and how the life is in pediatrics. Just name is Abrar Haider. If you want to go there, or you can ask me questions on my email anytime.
That's brilliant. Thank you, Abrar. Covered a lot of ground in a short period of time. Gave some really useful tips there about the changing nature of pediatrics. And you said there's a couple of changes since last year, isn't there, in terms of application process?
Application process wise, this year they haven't announced anything so far, but I am hoping that because they're not bothered about the anymore about COVID that much, and the interview would be, I am hoping they would be face to face this time. And the application process, I think it will be similar as compared like as it was last year, but the interview would be different, because the interview would be as it used to be prior to COVID, like 8-9 stations, in which one portfolio station, one reflection station, one communication, and there used to be one teaching station as well. And communication stations were like 2 of them, and that was like an OSCE exam. You just go through the like one station, two station, and every station like 10 minutes, out of which like 6-7 minutes was the station, but and then 3-4 minutes was the examiner questions, like an exam type interview it was. And it used to be, and then there was prescription writing as well in that interview.
And then you mentioned the YouTube channel, Abrar. Just let us know what that is, or type it in the chat so people can note that for later.
The most of the videos are in like they are in Urdu, Hindi, and the purpose is because I'm from Pakistan, and the language across the India, Sri Lanka, Bangladesh, most of the people they understand Urdu and Hindi, and just for the ease of them, I just like how the pediatrics is, and how do you prepare for the MRC-PCH exam part 1, how do you prepare for part 2, and how do you prepare for the clinicals. Like what like inspired me to make this channel was I used to get like 5-6 messages on my Facebook and on my emails, like guide us how to prepare for the MRC-PCH. So what I did is I recorded a video and put it on the YouTube. And now what I do is I just whoever asks me, I just give them link, like
that's really good. Yeah, I mean those kind of channels are super. There are a lot of doctors doing those these days. I think of Dr. Raja doing the psychiatry one and all other specialties. So,
Raja.
Great. And what was the channel name, Abrar? I'll put it in the chat.
Abrar Haider.
Great. So for all of you guys who are interested, who understand Hindi, Urdu, please have a look at that, because I'm sure there's a lot of common questions answered there. But I think you answered a lot of questions here as well, Abrar. There are some questions that have come through, but again, they're quite specific for individuals. So again, do you mind if we forward them on to you? So after this talk finishes, you can just quickly type some answers. That would be really helpful. There's nothing generic that I can see. Pooja, I don't know if you see anything generic. They're all pretty specific to me. But yeah, thank you so much. Thank you once again for coming on and doing this. Really helpful, short, succinct, to the point. And are you happy for people to contact you in any other way for general questions?
Yeah, they can email me, and they can, like, if they can find me on Facebook, they can message there.
So if anybody has some general pediatrics questions, please do. Again, once again, it's very kind of our speakers to give emails, because these are very busy doctors. As you can see, they're not only training, they're doing lots of other work around helping IMG doctors. So if you're going to email them, please do be mindful of the fact that it may take them a little bit of time to get back to you, and they may respond with links to videos and things that cover that kind of ground. But yeah, once again, thank you so much, Abrar. Really helpful. Have a good rest of the Saturday and the rest of the good weekend. Great to see you again, and we'll see you very soon.
Bye, Abrar. Thank you.